who wear glasses in the UK. More than 100,000 Brits have laser eye surgery every year. Joining me now, one of the UK's leading consultant ophthalmic surgeons in cataract and lens implant surgery, Mr. Bobby Qureshi. So, Bobby, tell us about laser surgery. I think a lot of people worry about it. They think, oh, laser on my eyes, this is not good news.
Laser surgery is very safe these days.
So it's better than it was? But
much better than it was. Yeah. There are many different types of lasers. Just this week we used a new nanosecond laser to treat dry macular degeneration for the first time in the UK. But most people think of laser eye surgery to correct long sight, short sight and astigmatism. And between the ages of about 20 and 40, it involves reshaping the surface of the eyeball, the cornea, to change the focusing ability of the eye.
So, but that's interesting that you say between those ages. So, outside of that, it's not useful.
Well, as we grow, the eyeball grows. So, up to the age of about 20, one wouldn't want to do any surgery whatsoever. Between 20 and 40, the eye stays pretty stable, so laser eye surgery works well. But once we're in our 40s, the lens inside the eye starts aging and changing. It becomes less flexible, which means we lose the ability to focus near and far, and we all start needing reading glasses. And it will happen to everybody on the planet at some point.
So if we're older, is laser eye surgery a no-go area then for us?
Well, there are better options these days, which are equally safe. And this involves taking out the aging lens and replacing it with an artificial one. And this can restore near, middle and far vision, and this will last forever.
Now, we've got a piece of film here of exactly what goes on. Just talk us through this. What's happening here?
This is actually the LASIK procedure, and the safest type is called LASIK Extra. We use a laser to create a little film which we lift off the front of the eye, and then we reshape the surface of the eyeball with another laser and put the flap back down again.
Yeah.
Now, to prevent regression, where your prescription comes back, we now put some drops onto the cornea and shine another light onto the eye, and that stiffens the cornea to prevent it bulging like this.
Which is what would happen if you didn't do that. That's what happens if you don't.
Absolutely.
Yeah. Wonderful. So, one patient who had this pioneering laser treatment to remove cataracts is Martin Ashenden. Martin, welcome. Martin. So can I be rude and ask your age then, Martin?
76.
Wow. So, and you, how did you discover that you needed this kind of surgery? What were your symptoms?
I had problems with cataracts.
Yeah.
And blurred vision.
Yeah.
And playing tennis and coaching tennis, I was finding I couldn't judge the ball, the distance.
For a sportsman, this is bad stuff, isn't it?
It was. I went bananas.
Yeah.
Anyhow, I happened to see an article in the Mail on Sunday regarding the London Eye Hospital and Mr. Qureshi and their new procedure.
How long did it take, the procedure
The procedure?
itself? Yeah.
For the eye?
Yeah.
6 to 8 minutes.
Astonishingly quick. So it sounds as though it's less invasive than it used to be.
It is. We used to need a needle and a blade to cut into the eye, but with the new femtosecond laser, I can do 80% of the operation in 30 seconds at micron levels of accuracy. And then once we've removed the patient's aging lens, we put a new one in, and these are made of very sophisticated foldable plastics which go through tiny incisions. And so the whole procedure surgically is only about 200 seconds, really, without using any needles or knives. And it has the ability to restore near, middle and far vision, and this will actually last forever.
So what's it like now then, Martin, your vision?
Perfect. I have long, middle and near distance.
And this will last forever? There'll be no correction?
Assuming you don't get other conditions like macular degeneration or glaucoma.
So are we talking here then of, in several years' time, if everybody underwent this, nobody would need glasses?
Absolutely. This has the ability to restore sight, much to how we were when we were children, in terms of near, middle and far. It's not absolutely perfect, but it's very, very good, enough for us to be independent of our glasses for pretty much everything most of the time.
It's a tremendous advance, Anita.
Life-changing. I mean, as we age, all of us will find our lenses age with us, and they can get cloudy. So often people, like Martin with cataracts, find that the vision goes from being very clear to almost looking like you're looking through a frosted glass. And this can actually really affect people's vision, particularly at night, and affect their ability to do sports and things like that. So it's life-changing, and it's really exciting, this new technology.
Clearly, from your point of view, Martin, it's literally given you a new lease of life.
I'm delighted.
How's your tennis?
Brilliant.
Let's clarify this then, Bobby. So there's a certain laser procedure which you can use on people from 25 to 35.
Absolutely. If you're between about 20 to 35, 40, and you're a suitable candidate, I would have LASIK or LASIK Extra.
Yes.
And that would mean you'll have good near and far vision, but but only until you're 40, when you will start needing reading glasses like everybody else in the world.
So those of us who are over 40 and who've got, defective vision, both distance and close up...
You're far better removing the aging lens from the eye, which is as safe these days as the laser eye procedure and can be performed using a laser also, and put an implant in which will give you near and far vision forever.
Is this only available privately at the moment?
At the moment it is.
And what would it cost to have it done?
I suppose it starts at about £4,000 or £5,000.
For both eyes?
That's per eye.
Yeah, per eye, right. So you're talking ballpark £8,000 to £10,000. But